Hi, I am Dr. Felice Gersh, your integrative OBGYN physician. And we're going to talk today about a very important issue because of there being so much confusion about this. I see this all the time in my practice. There is a great deal of confusion concerning the ingredients of birth control pills, oral combined contraceptives, versus what's in bioidentical hormones used for menopausal hormone therapy. It's really like apples and oranges, only I wouldn't know really which one is the apple or the orange. I would have to say more like fake, jelly beans versus real fruit, because that's the real difference. The hormones that are in bioidentical therapy for menopausal and perimenopausal women are identical molecularly in every way to the hormones progesterone and estradiol produced by the ovaries of functioning, fertile, reproductive aged women. The chemicals that are in combined oral contraceptives are not the same at all. The majority, but not all, I'll go into that in a bit, the majority of these pills, known as birth control pills, that have both an estrogenic component and a progestin component, have as the estrogen component EE, ethinyl estradiol. Now, the estrogen produced by ovaries is estradiol. That's actually kind of short for 17-beta estradiol. Ethinyl estradiol sounds really similar, but it is so different. You can have something that's quite similar, but even a few differences in the molecules can change everything about how it works in the body. When you take estrogen like ethinyl estradiol in the body, it turns into primarily a type of estrogen called estrone, which works on the alpha receptor for estrogen receptors. When you have ethinyl estradiol, the effect is pro-inflammatory. Yes, pro-inflammatory, which is not what we want. When you think about some of the side effects or dangers of birth control pills, it includes things like increased risk of blood clotting. Blood clotting is a feature of the pro-inflammatory effect in the body when the inflammatory state is present, which includes a pro-clotting mechanism, which is designed in a really appropriate situation to keep you from bleeding to death if you have like a big laceration. But that's not what we want activated. We don't want our platelets to clump together and cause inappropriate clotting, but that's a very well recognized side effect potential of birth control pills, which is one of the reasons why it's not given to certain populations, women who are already in a more pro-inflammatory state, like older women, women in their 50s and beyond, women who, for example, already have had blood clots, women who have serious hypertension, high blood pressure, if they've had a previous stroke, a previous heart attack, or even serious metabolic diseases like uncontrolled diabetes, autoimmune diseases that are really rampant, you would not give this to women. And the one that is very well known as a contraindicated group would be smokers, because that is a pro-inflammatory type of a situation. Totally different with the estradiol that the ovaries make. Estradiol modulates the immune system, so it keeps everything in an anti-inflammatory state when everything is right with the world, and only triggers a pro-inflammatory situation when you need it, like if you're being invaded by bacteria or viruses, if you're injured in an accident, you have a big laceration, you have trauma to your body, then you're supposed to activate the pro-inflammatory pathways. And estradiol, unlike estrone, operates the off switch for inflammation. So it turns it on when you need it, and then it turns it off, and then you go into the anti-inflammatory pro-resolution and healing phase. But estrone doesn't do that. It's like you're stuck in the on switch mode of inflammation. So these are like huge differences. And it just is so sad because the FDA makes by law the same warnings go on every estrogen product with no distinction for the differences. Remember, estrogen is not a hormone. In the human female, it is a family of hormones. And the ones that are found in the adult female are E1 estrone, E2 estradiol, the estrogen made by ovaries, and E3 estriol, the dominant estrogen made by the placenta in pregnancy. And they have different effects. And the analogy that I sometimes use is fats. So now most people know that there are good fats and bad fats. And the bad fats are manufactured fats like trans fat, which has now been banned because it's so hostile to the body and it's so anti-health. And then if you have too much of certain types of fats, or if you have rancid or oxidized fats, that's really bad. But we don't want to paint all fats with the same brush. We don't want to paint all estrogens with the same brush. But that is what is happening. And I don't want even you to think that estrone is evil. It isn't evil. It's just that it should be in the right place at the right time in the right amount. And birth control pills are going to create a predominantly estrone type of environment. Some estrone does get converted into estradiol, but it's not the same balance. It's not the same as starting with the human bioidentical estradiol. So the effects are really different. Birth control pills, by the way, act to do what? To prevent fertility. That's what they were invented for. So they shut down ovarian function. So you basically take the ovaries off the map. They're not doing anything. So you're not going to ovulate and you're going to make little to no hormones from your ovaries. And they're replaced with the chemical mimics, but they're not clones, they're not identicals that are in the contraceptive pills. And that's also similar to the patches and the rings. I don't want you to think that they're different. They are different only in the delivery system. Essentially, they have the same effects in the body. Now, what about the bioidentical estradiol and progesterone? They are not given to prevent pregnancy. In fact, they given a woman, it may actually make them more fertile if they have insufficient amounts. In fact, that is sometimes used in fertility clinics to give them bioidentical estradiol to help them with better cervical mucus, and also progesterone to help them have a healthier luteal phase, to help an embryo to implant and to have things continue and to promote a pregnancy. So they're not contraceptives, and they are not given if they're given in, say, a perimenopausal woman who is having symptoms and is an insufficient producer of hormones, but they still make some. It's not going to create a contraceptive effect. These are not contraceptives. They will not shut down your ovarian function. What they do is in perimenopause, they augment the amount in the body. I consider them like a safety net so that you can't fall below a certain amount, but they're not going to shut down your ovarian function like contraceptive hormones do. So it's really different. And when you talk about the progesterone versus progestin, there is no birth control pill that has bioidentical progesterone. Only hormones used in the menopausal situation or perimenopausal situation include the healthy human bioidentical progesterone. And there is a reason for that, because the goal of contraception is to prevent pregnancy. And the way that birth control pills work is they stop ovulation from happening. So the eggs will not be released. If there's no egg released, there is not going to be fertilization of an egg. There will be no pregnancy. So you can't use bioidentical progesterone in a pill because the amount that you would have to use to actually shut down ovulation, which is not the goal of the human female body, it's to be fertile, not to be infertile. So you'd have to use such a massive dose of bioidentical progesterone that it would not be tolerable. Plus, the half-life of progesterone of real human bioidentical progesterone is too short for it to be used as a contraception, because you'd have to take multiple pills in a day. So that would not be very feasible, because its effect is going to be too short-lived in the body. But the progestins, that's a made-up word for pretend progesterone, that are in the hormonal contraceptives, that is never, like I said, progesterone. And there's a whole variety of them, and they have different effects. Not all of them, but the majority of them are derived from 19-nortestosterone, and they end up having some androgenic effects. So they can actually give women like facial hair or acne, and they all have like warnings that they can do that. The reason it doesn't happen in every woman is because the ethinyl estradiol in the contraceptive increases sex hormone binding globulin, which binds up circulating testosterone, so it lowers the amount that's available on the tissues. And as well, by shutting down the ovaries, the testosterone production from the ovaries is going to be much lower. But it's a complex thing, and it's not physiologic. It's not natural. When you go on birth control pills, you're not regulating cycles. You're getting rid of all your cycles, and you're replacing them with real blood, but fake cycles, because you're not ovulating. That's the whole point. And in terms of the effects, so bioidentical estradiol does not increase blood clots. It does not increase breast cancer. There is data to show a small increased risk of breast cancer, and also, this is not controversial, of cervical cancer in women who use contraceptive hormones. There may be a decrease in ovarian, and that's still, some of the data is a little confusing, but that's somewhat out there, and definitely can lower uterine cancer, endometrial. But there's a high price to be paid when you take these contraceptive pills during the reproductive years. So you're going to have impacts on many organ systems, which we're not going to go into right now. But I want it to be so clear that these are not the same, and they have very different effects, because so many women are told, well, you don't want to use bioidentical hormones or any hormones in the menopause because they are going to increase your risk of blood clots. They're going to increase your risk of breast cancer. They even may increase your risk of dementia and terrible things like heart attacks and strokes. But that is not true for human bioidentical hormones when they're dosed appropriately, because that makes them more physiologic. Human beings did not evolve for their own natural human hormones to harm them. There is no mechanism. And I give these long lectures on all the effects of estradiol in the body, how it increases nitric oxide and prostacyclines, which prevent platelets from just randomly clumping together and creating clots. It increases, like I just mentioned, nitric oxide. It lowers inflammatory peptides and such, like endothelin-1, which promote vasoconstriction, hypertension, artery constriction, and it helps maintain the health of the linings of the arteries, maintains health of everything. In terms of like cholesterol, it does actually help to maintain healthy levels of cholesterol and prevent oxidation of cholesterol, which is what leads to plaque formation. Bioidentical estradiol prevents oxidation of cholesterol, and it maintains mitochondrial function, so you make energy and you have a healthy heart. And so it has all the opposite effects because it is the right hormone for the female body. Our own bioidentical hormones were not put in our bodies to harm us. They were put in our bodies to maintain optimal function of every organ system. And other things that people are so afraid of, like let me mention breast cancer again. So there is a small increased risk with breast cancer in women who use birth control pill hormones. It's not huge, but it is an increase. What about with bioidentical hormones? We know some mechanisms. Estradiol helps to prevent DNA breakage and damage. It helps to cause senescent, yucky, like zombie cells to kill themselves. It promotes autophagy, cellular renewal. These are all things that help prevent cancer. It maintains optimal state of the immune system so you don't have that pro-inflammatory state, which leads to DNA damage and cancer. You have healthy metabolism, and we now know cancer is a metabolic disease. It's derived from inflammation, and you have these senescent cells, these crappy cells that should kill themselves, but they don't. They get DNA damage and breakage, and then they develop into cancer. Estradiol helps to prevent all of that. And it's not causing dementia. It actually helps prevent dementia. And progesterone too, real bioidentical progesterone is amazing. It's neuroprotective. It's not at all what's in these contraceptive pills. Now, I have to just divert for a minute to say, I am the ultimate feminist. I was a feminist when feminists first came on the scene. I cheered on Gloria Steinem. I was supporting the Equal Rights Amendment for women. I am totally pro women's reproductive rights and female power, okay? But I want women to control their reproductive destiny. I want women to become super agers. I don't want women to have to live with all the degenerative diseases associated with aging that can be largely delayed or even prevented with optimal hormone therapy, along with everything else, all the proper lifestyle. It's not good enough just to give out hormones. It's in conjunction with eating the right diet, exercise, getting sleep, having love, having purpose, having clean air, water, and not being poisoned by our environment in other ways. We want to have healthy, long lives. Will be cheap for the society because we don't have to employ all kinds of hospital equipment and interventions. We don't want to be in the medical system at all if we can avoid it forever. We just want to have maintenance. We don't want to have interventions because of problems. And this is what my goal is. And I don't want women having babies when they're not ready. I want everyone to have their own reproductive destiny controlled. But we have to understand what's going on. And we have to then try to find even better ways to control reproduction so we have healthy contraception. But I don't want you to think that I'm just totally 100% anti-contraceptive pills. There's a place for everything and a time for everything. But it's important to know the differences between these compounds because it matters when it creates fear, because the pervasive misunderstanding of hormones, using the words incorrectly. So bioidentical hormones given properly with the proper dosing and the proper form, transdermal estrogen, and you can have oral progesterone, that's the usual way, but sometimes you can use other modalities like creams. But the main thing is to use human bioidentical hormones, exactly identical to what the ovaries make, and to understand that other compounds that are used are not found in a human adult female in that way ever. So if we're going to trick Mother Nature as we age, we want to use Mother Nature's hormones. We don't want faux food, we don't want ultra-processed food, and we don't want chemical pretend hormones. You can call them a hormone, but they're not human hormones. We use these words in a way that adds confusion. So I'm here to clean up the act of this confusion. Bioidentical hormones are healthful and help to keep women healthy. I'm not saying you won't age. Of course you're going to age. The point is to have healthy longevity, to optimize health and prevent illness, not just treat illness at every stage of life.